Have you ever wondered how your Medicare options change if you're turning 65 but you're still working? In that case, you're not alone. Many people, they assume that they need to sign up for Medicare the moment they turn 65, but that is not always the case,
Okay, you don't actually have to sign up.
especially if you have employer coverage. I'm Cameron Giardini with Giardini Medicare, and today I'm going to walk you through everything that you need to know about navigating the intersection of employer coverage and Medicare at age 65. This is easily one of the most common and confusing aspects of Medicare, but by the end of the video, you will have a clear roadmap for making the right decision for your specific situation.
It all makes sense now.
We will cover when you are first eligible for Medicare, what actions you should and should not take as you approach age 65. We will talk about how your employer's health plan, especially the size of the employer, will significantly impact your Medicare decisions. We will also talk about critical relationships between health savings accounts and Medicare. We will talk about how to effectively compare your employer coverage to Medicare options, and we will talk about what you can expect beyond age 65 if you do delay Medicare. The decisions you make today will have long-lasting financial impacts, so let's clear up the confusion. Most people, they first become eligible for Medicare when they turn 65. For most of us, Medicare eligibility, it begins the first day of the month you turn 65. But there is one exception to this. If you're born on the first day of the month, you become eligible for Medicare the first day of the previous month. So for example, if your birthday is August 19th, you'll be eligible for Medicare starting August 1st of the year you turn 65. But if your birthday is August 1st instead, you are eligible for Medicare starting July 1st, a full month before your actual birthday. While there are other ways to qualify for Medicare before age 65, such as receiving Social Security disability benefits for 24 months, having ALS, or end-stage renal disease, instead, we will focus today on the most common scenario, which is, of course, turning 65. But here's the big question that a lot of people simply don't consider. Just because you're eligible for Medicare at age 65, does that mean you actually need to enroll at that time? The answer heavily depends on whether or not you have employer health insurance beyond age 65, as well as a couple of other key factors that we will highlight. We will also link to an excellent decision guide that is actually published directly by CMS, which is Medicare, and this will help walk you through exactly what we're talking about in this video. First, let's address something important. Medicare, it is not free.
It's not?
While most people do qualify for premium-free Part A, the same is not true for Part B. In 2025, the base Part B premium is $185 per month, and it can even be considerably higher if you're subject to the income-related monthly adjustment amount known as IRMA. And again, that is just for basic original Medicare coverage. This does not include potential premiums for Medicare Advantage plans, Medicare supplements, or Part D prescription drug plans. Enrolling in Medicare just because you turn 65 without considering other options, it can result in wasted money, usually in the form of paying monthly premiums for Medicare coverage that isn't providing much, if any, actual financial benefit, while you are also enrolled with employer group health coverage. There are three key factors to consider when you're deciding whether or not to enroll in Medicare as you turn 65. Number one is the current employment status of yourself or a spouse. Number two is the size of the employer that is providing employer group health coverage. And number three is whether or not you have creditable prescription drug coverage. We will break each of these down. But before we do that, if you do have any specific Medicare questions, whether it relates to this video or not, make sure to comment them down below. And you can also scan the QR code you can see here on the screen to join our private Medicare Q&A Facebook group. So the first question that you need to answer when deciding whether or not to delay Medicare enrollment is, are you currently covered by employer group health insurance due to current employment of yourself or a spouse? COBRA coverage, retiree coverage, individual health insurance such as through the health insurance marketplace, and Veterans Affairs coverage are all examples of coverage that do not qualify, since again, this is strictly for active employer group health insurance due to current employment. For example, Paul is turning 65 and he is currently covered by his wife's health insurance. She is 61 years old and she is actively employed as an engineer at an auto company. Paul's coverage does qualify because it's based on current employment of his wife. But why does employment status even matter in the first place? First, it prevents a lifetime Part B penalty, and it allows you to enroll in Medicare Part B using a Part B special enrollment period after age 65, and we will cover that a little bit later in this video. Not only does your coverage have to be based on current employment like we just talked about, but to safely delay Medicare beyond 65, the employer providing the plan must have 20 or more employees. This also includes part-time and full-time employees, as you can see here from the Medicare guidelines. Although we will link to these specific guidelines for employer size and how it is determined, make sure you confirm your employer size directly with your employer before making any final decisions. It's impossible for us as brokers to know your specific plan's employer size. With that said, why does employer size matter so much? Well, it determines which coverage is primary and which is secondary once you're eligible for Medicare. With employers of 20 plus employees, your employer coverage remains primary to Medicare once you become eligible for it. But with small employers, which are fewer than 20 employees, Medicare becomes primary to your employer coverage once you become eligible at age 65. Having larger employer coverage allows you to delay Medicare without facing medical claims issues and potentially large unpaid medical bills. And you can even see here an example of why this is so important, because we have on the screen a letter from one of our actual clients who had an under 20 employee plan, and they were telling him he needed to enroll in Medicare to avoid possible claims issues. It is also worth noting before moving on that for those of you eligible for Medicare before age 65 due to disability or other factors, the employer size threshold, it is different. It becomes 100 plus employees, and the coverage can actually be based off of a family member and not just a spouse, like we talked about. Additionally, for those 65 and older, multi-employer plans, they may have different rules, which you can see here on the screen from the specific Medicare guidelines. So again, as always, make sure you confirm any specific details directly with your plan before making a final decision. For the remainder of this video, we will assume that you are covered by a plan with 20 or more employees, and we will have another video in the near future focusing on what to do if you're covered by a small employer with under 20 employees. Now, the third factor, again, for delaying Medicare past age 65 is whether your current employer's prescription drug coverage is considered creditable for Medicare Part D purposes. This is kind of a weird word.
Weird. It is weird.
But it simply means that the prescription coverage provided by your plan is expected to pay, on average, at least as much as the standard Medicare prescription drug coverage. But why is this important? Well, having creditable prescription coverage allows you to delay enrolling in Medicare Part D prescription coverage past age 65 without facing a lifetime Part D late enrollment penalty. And how do you confirm if your coverage is creditable? Well, any entity, that is an employer in this case, that offers prescription drug coverage to Medicare eligible individuals, they must disclose whether their coverage is creditable or not. The creditable coverage notice that you can see here on the screen, it's typically sent to employees in the fall, and you can also see another example of a non-creditable notice here just in case. If you're uncertain about whether or not your coverage is creditable, make sure you contact your HR department, and you should really do it in writing. As an added note, employer size, it doesn't always determine whether your prescription coverage is creditable or not. Instead, it depends entirely on the prescription coverage level provided by the plan. Let's quickly recap what we've covered so far. Delaying Medicare Part B, it can potentially save you hundreds in monthly premiums, and you can likely safely delay Part B if you're covered by an employer group health plan due to current employment, which again is either yours or a spouse's. And you have to make sure that the employer has 20 or more employees or is part of a qualifying multi-employer plan. Delaying Medicare Part D, it depends on whether or not your employer coverage provides prescription coverage that is creditable for Medicare Part D. We will address whether to delay Part A shortly, but first, let's look at some examples to make everything even more clear. Example 1, Frank is turning 65 and he gets health insurance through his wife, who is 63 and works as a chemical engineer. Her company has hundreds of employees, and her coverage is due to her current employment. This means that the group health coverage will remain primary to Medicare even when Frank becomes eligible at age 65. He also won't face a Part B penalty in the future if he enrolls during his special enrollment period. Frank's wife also confirms with HR that the prescription coverage is considered creditable for Medicare Part D. So based on this, Frank can safely delay Medicare Part B and Part D coverage, at least for now, and we will discuss Part A shortly. Example number 2. Janet plans to retire in June 2025, and she turns 65 in November of 2025. She plans to elect COBRA coverage to continue her health insurance after retirement. Although Janet's COBRA does continue her employer coverage, and her former employer has hundreds of employees, her coverage is no longer based on current employment after June when she retires. This means that she cannot delay Medicare. She'll need to enroll in both Part A and Part B effective November 1st once she becomes eligible for Medicare. Janet might be able to keep her COBRA coverage as secondary to Medicare if she wants, but she will likely be better off comparing her options to Medicare Advantage and Medicare plans to see if it simply makes more sense to just leave COBRA behind. Example number 3, Stacy is turning 65 in mid-2025, and she works full-time at a company with 57 employees. She plans to continue working in the foreseeable future, and after checking with her employer about her prescription coverage, she actually confirms it's not creditable for Medicare Part D. Based on this information, Stacy can still delay Medicare Part B and continue her employer coverage as primary, but she should likely enroll in premium-free Part A and a Part D plan to avoid a lifetime Part D penalty down the road if she wants to stick with her employer medical coverage. Now that we've established when you can delay Part B and Part D, let's talk about Part A, which again is premium free for most people. The big question is, should you just enroll in premium free Part A at 65, or should you delay both Part A and Part B if possible? The answer depends primarily on one factor. Are you or your employer contributing to a health savings account, which is an HSA? If you're not contributing to an HSA, there is usually no reason to delay enrolling in premium-free Part A. It can serve as secondary hospital coverage to your employer plan, and again, it is usually at no cost to you. However, if you or your employer are contributing to an HSA, this changes everything. Once you're enrolled in any part of Medicare, including premium-free Part A, you will no longer be eligible to make contributions to your HSA. You can see this stated here directly from the IRS. But if you are able to delay both Part A and Part B beyond age 65, you can continue contributing to your HSA despite being eligible for Medicare. It's worth noting that you can still use existing HSA funds for qualified medical expenses once you're enrolled in Medicare. You just can't add new money to the account. Make sure, of course, to watch our HSA specific video for many more details if this applies to your situation. Now we know why you may want to delay Medicare Part A, but can you actually do it?
Why wouldn't I?
This depends on whether you're collecting Social Security or Railroad Retirement Board benefits before you turn 65. If you're collecting these benefits at least 4 months before turning 65, you'll be automatically enrolled in both Part A and Part B of Medicare when you're first eligible. While in that case it is possible to decline Part B, you cannot delay Part A if this is the scenario. If you're not collecting these benefits, however, you will not be automatically enrolled in either Part A or Part B as you turn 65. If you do want those coverages, you would have to actively apply for them in that case. We'll look at a couple examples to clear this up. Example number 1 is you are not collecting Social Security benefits and you don't have an HSA. In this case, you won't automatically be enrolled in either Part A or Part B as you turn 65. Since you're not making HSA contributions, you can enroll in Part A only, which again is not automatic. And you can do this while also deferring your Part B coverage until you leave employer coverage in the future. Example number 2 is if you are not collecting Social Security benefits, but you are contributing to an HSA. In this case, you won't automatically be enrolled in either Part A or Part B, since in this case you do want to continue HSA contributions past age 65. You should delay both Part A and Part B. To do this, you simply do nothing. Yes, it will feel weird, and people will tell you you're wrong even when you're not. Example number 3 is you're collecting Social Security benefits before age 65 and you don't have an HSA. In that case, you'll automatically be enrolled in both Part A and Part B, and your Medicare card will arrive in the mail a few months before you turn 65. You can then decline Part B if you want, and then you would continue to have premium-free Part A coverage as secondary to your employer plan. Our final example, number 4, is you're collecting Social Security benefits and you're contributing to an HSA. Like example number 3, you will also be automatically enrolled in both Part A and Part B when you turn 65. While you can defer Part B in this case, you cannot defer Part A while you're collecting Social Security benefits. You can continue your employer coverage alongside with Part A, but you will need to stop or adjust your HSA contributions based on when your Part A becomes effective. We have covered when you may not need Medicare at 65, but what if you actually want it despite having employer coverage? Here are some important things to consider. First, are you covering a spouse or dependents with your employer health insurance? If so, what happens to their coverage if you leave the plan? Next, how does the cost and coverage of your employer health insurance compare to Medicare options, including prescription drug coverage? Remember, employer health insurance premiums, they are often paid using pre-tax dollars, while Medicare premiums are paid with post-tax dollars. This difference can affect the true cost comparison when looking at them side by side. Third, what are your specific healthcare needs? Do you have particular conditions or treatments that might be better covered with one option versus the other? To help you compare, let's look at the typical costs of the 2 main Medicare paths that you will want to compare to your employer group health plans, cost and coverage. On this chart, you can see that Medicare Advantage plans will unsurprisingly have lower cost comparisons to premiums, but they will often have higher potentials for out-of-pocket medical costs on the back end. You'll also probably notice that there is a wide range of costs when it comes to the monthly premiums and coverages for Medicare Advantage and Medigap plans, and that is because both of these options will vary greatly based on your age and where you live in the country, just like we talked about in our previous video that you can see here on the screen. It can also depend on if you have IRMA surcharges due to higher income like we talked about earlier. Again, let's look at some examples of people choosing between employer coverage and Medicare.
Let me give you an example.
Example 1, Janet is turning 65 and she is currently covered by her husband's employer plan. He is actively employed at a company with 150 employees and their prescription coverage is creditable for Part D. Janet is not yet collecting Social Security, so while she can delay most parts of Medicare, or even all parts of Medicare in this case, she was recently diagnosed with cancer and needs ongoing medical treatments. Her portion of the employer insurance costs about $200 per month, and they have a family maximum out-of-pocket of $6,000 per year. Even though the employer plan has a lower premium, Janet opts instead for Medicare with a Medigap Plan G and Part D coverage for approximately $350 per month in exchange for only a $257 yearly medical deductible, which causes her to decide that this is the better option overall for her healthcare needs. Example number 2, David is turning 65 and he is working at a company with 55 employees. His prescription coverage is creditable for Part D and his monthly premium for the plan is $400 per month with a $2,000 annual deductible. He initially wants to compare his employer coverage to his Medicare options, thinking that Medigap will probably offer better coverage at roughly the same monthly premium. However, David earns $250,000 per year, which places him in the second highest IRMA tier. His Part B, his Medigap, and Part D in this case would now cost approximately $800 per month, which is double what he expected and twice his current employer premium. Given this and his lack of current healthcare needs, he he decides that instead he should stay with his employer plan since it makes more financial sense for the time being. Example number 3, Susan is turning 65 and working at a large employer with creditable prescription drug coverage. Her husband Bob is 62, retired, and covered by Susan's employer plan. They pay $200 per month for Susan, and they pay $300 per month for Bob to be on the plan. Susan is looking forward to Medicare eligibility since she is interested in Medicare Advantage plans. Her current plan has a $3,000 deductible and a $6,000 maximum out of pocket. The problem in this case is Bob. If Susan leaves her employer plan, Bob would need COBRA or individual health insurance. Both options are significantly more expensive than his current coverage. Susan, because of this, she decides to stay with the employer plan until Bob is eligible for Medicare at age 65. And our final example, number 4, is Craig, who is turning 65 and has employer coverage with a premium of just $150 per month. The coverage is generally good, but Craig does have severe back pain, and he is now requiring a specialized surgery. He finally finds a surgeon that he can trust to do it, but the problem is that his surgeon is not in the employer plan's HMO network. Despite Medicare with Medigap and Part D costing about $350 per month, more than double his current premiums, Craig's surgeon does in fact accept original Medicare. Because of this, he decides to leave his employer coverage for Medicare and Medigap to access his preferred surgeon and eliminate network restrictions going forward, regardless of the cost. Finally, let's finish today's video by talking about what happens when you do eventually retire or leave your employer coverage after age 65. When this happens, you do qualify for a Part B special enrollment period, which lasts up to 8 months following the month your coverage ends. But please don't wait that long. A good rule of thumb instead is begin planning 4 to 6 months before your employer coverage ends. You'll need the form CMS L564 to prove that you've had employer coverage since turning 65. An important note is you will need multiple of these forms from multiple employers if you did have multiple employers after age 65. The other form, the CMS 40B, is the other form you will need, and that is the actual application for Part B. We will link to both of these documents in the description. You can typically apply for Part B using the special enrollment period about 3 months before you actually need your coverage to be effective. Just note that you and your spouse will each need all of the completed versions of these forms if you're both enrolling. There are also online versions of the Part B application, so we'll link to that in the description. For some other special considerations to keep in mind, if you delayed both Part A and Part B past age 65 due to HSA contributions, your Part A effective date will be retroactive 6 months from when you do ultimately apply for Medicare. Make sure to adjust your HSA contributions accordingly to avoid tax penalties. Another thing to know is if you can't get a completed L564 from your current or former employer, alternative forms of proof are available. You can see those on the screen and we will link them below. Finally, although this is uncommon, if you have had more than an 8-month gap between employers after turning 65, you won't qualify for the Part B special enrollment period. This could result in penalties and enrollment limitations. Overall, navigating the intersection of employer coverage and Medicare at age 65, it can be complex. Now you should have the knowledge, thankfully, to make informed decisions for your specific situation. Of course, once you do make the transition to Medicare or right before that, you will want to understand the difference between Plan G and Plan N, so make sure you watch that video after this one.